You can do in here in the water and walk almost pain-free comparatively to being out of the water and having to use your walker and things like that, okay? And we start you off slow and we'll gradually progress your speed as you tolerate it, okay? You could probably take a little bit more on the jets right now, huh? Why don't we have you turn sideways and do some of the side stepping also, okay? If you would, please. Let's have you turn and do some backward walking. And we could have you turn all the way and do the other side so you get all four directions. Let's start with Frisbee. Have you do tighten the trunk, push down, pull up, slow and controlled, okay? The Frisbee, we're working at the core stabilization with the Frisbee, having you tighten your core and pull up and down and work your trunk muscles, your back muscles. With the hand paddles, we're going to focus on, again, some core exercises and some strengthening for your upper body a little bit, okay? So we'll start going forward and backward like that. If you tolerate it today with your knees, Gary, if you, instead of leaning against that, instead of leaning against the railing, to have you actually stand, and you'll have to use your core as well that way. As you go forward and backward with your arms, your core will be stabilizing at the same time. Let's now go forward and backward this way, side to side. Opposite arm, good. This is an exercise that we'll occasionally have the patient actually go to one leg. So they're having to stabilize through their pelvis. They're using their low extremity to stabilize as they go back and forth. So we get strengthening here as you pull those down and control them on the way back up. The other thing we get is as you pull down, we get some unloading in the water in your low back. Let's bring you up and have you do, hanging onto that bar and do the squats, please. So particularly with Gary's knees out of the water, this would be impossible for him to be able to tolerate. But in the water, he's able to flex through his range of motion, and with the unweighted environment, can do some closed chain strengthening exercises. Yeah, we chart his progress on the things like knee range of motion and strength that we tested. We also tested tolerance he had to the exercise that we did, so that when he started, his knee range of motion got from less than 90 degrees to about 110 degrees, which is functional knee range of motion by the time we finished. And then I already mentioned his exercise tolerance increased dramatically. His function increased dramatically as far as ability to move within his apartment, his ability to get from his kitchen to his bed. Didn't have a lot of space. It was a very small apartment. It was hard to move his walker, which was very difficult for him initially. By the time he finished treatment, he didn't really rely on the walker in the house as much. He was able to get around much better within his own home. And a lot of the progress was functional progress like that we really looked for with Gary, was the way that his overall general function, his ability to be safe, and his ability to take care of his ADLs. He lives by himself, and there's anybody else to help him, so he needed that. Probably based mostly upon the fact that he was in such poor condition to begin with. It was probably 6 weeks, and he could say, "Oh boy, I can tell this is getting easier. I'm doing better." Towards the end of his treatment, he could really tell a huge change, and it was a change that my coworkers that work here not only thought it was changed physically but mentally. He was a happier person. He was a better person because he was more functional. He could not have been successful in therapy without the underwater treadmill. It would have been impossible for him to really be successful. Without that treadmill, if he had just been in a pool, he could have done a number of things in the pool, but could have never had the consistency and gotten the cardio effect that he got on the treadmill. just in a pool. Even if he was aqua jogging, for example, I think that the treadmill was much more beneficial in him having a goal, being able to see his speed, being able to see his time on that computer screen. I think those things were important to him as motivators for him to really stick with what he was doing. It's effective because, first of all, the comfort level in the water. Some patients are not comfortable in water, and those we have to weed out. But comfort level in the water, you know, with the pool being, we keep it about 93 degrees. So when they get in the water, they feel comfortable, and they also, with the decreased weight bearing they get in the water, it makes a huge difference in their ability to normalize their gait and to train in a way that they could never do outside of the water. We have a wide variety. The name Hand Orthopedic Rehabilitation Specialist, one of the things we do is specialize. And we have one of our therapists specialize in geriatrics. We have some specialties in women's health. We have some specialties in orthopedics and in sports medicine. And what that means is that we have, our therapist treats geriatric patients. We get a lot of patients that have balance issues, post-stroke, that have some serious gait abnormalities and gait deficiencies that respond very, very well to the pool. They're able to get in the water, they're comfortable, they have the handrails to hold on to, and they can do some things in the water they could never do outside of the water. And we can progress them that way. On the other side of things, with the orthopedics and the sports, we get a lot of patients that maybe have an injury where they are post-op for trauma, or are runners that have leg pain of some kind. They can't train like they want to train for their races and for the athletics that they do.